And as promised now, Dr. Ben Beard, who is the Deputy Director at the Division of Vector-Borne Diseases for the Centers for Disease Control and Prevention. Sir, I appreciate you being here. Thank you very much. Tell me the CDC's role as we sit here right now in combating Lyme disease or studying it.
Yeah, thank you. It's good to be here. And our role really is first of all, in national disease surveillance. And so what I mean by that is that we track all the reportable diseases. Lyme disease is a reportable disease. So we track that disease trends, namely primarily the distribution and numbers of cases, so we can tell how that's changing from year to year. The second thing is that we're involved in developing diagnostics, and so that we can improve the diagnostic tests that are available for Lyme disease. And thirdly, we're involved in preventing and controlling cases of Lyme disease.
Let's go through each one of those things. Mm-hmm. You're looking at the numbers of Lyme disease cases. I just read an article that said it is one of the fastest growing infectious diseases in the country. Is that true?
Yes, in fact, of the 60 or 70 some odd diseases and conditions that are reportable to CDC each year, Lyme disease every year is in the top 10, if not the top 5. And here in the Northeast, in the region of New Jersey, it's actually the third most common of all reportable diseases.
And diagnosis has been a problem, right? People have it and don't know they have it.
That can certainly be the case. And the reasons why is that the ticks that carry Lyme disease are very tiny, and often they bite and their bite goes unnoticed. And patients may have the telltale sort of Lyme disease rash. And if they do, then that's actually good because it makes it more easily diagnosed. If they don't have that rash early on, then those symptoms can go unnoticed, or they can go sort of quiet until patients develop longer-term persistent symptoms. So it could be arthritis, it could be cardiac conditions, and a lot of those types of conditions are much more difficult to treat.
Are we taking this serious enough? I know you are. As a society, with governments, are we dealing with this problem as much as we should be dealing with it?
Well, I mean, from my point of view, we're doing everything that we could, but there's so much more that we need to be doing. With over 300,000 new cases of Lyme disease occurring every year and getting worse and worse every year, clearly this is a huge public health concern.
There used to be a vaccine for this.
Yeah, right.
I know animals still get it, but Lymerix was out there and it was thought to be safe and it was effective and it just went away.
Well, it's a long story, longer than the time we have for this interview. But the vaccine in the FDA published Vaccine Adverse Event Report System, the VAERS study, it did look safe and effective, but there were a number of people that complained that they had chronic symptoms, persistent symptoms that developed after they took the vaccine. And so there was a lot of pressure on the company to remove the vaccine, and so they did. And it was a lot more complicated than that. The recommendations were very complicated, and the good news is that there is a second generation Lyme disease vaccine that's under development right now, and it's in clinical trials in Europe, and it will be another probably 5 or 10 years before it could be available for use.
So what can we do in the meantime?
In the meantime, Lyme disease prevention really focuses on personal protective measures. And these are things that you can do as an individual to protect yourself from being bitten by ticks. Wearing repellents, wearing light-colored clothes when you're outside so you can, in tick-infested areas, doing tick checks. So when you come back indoors from being outside to inspect yourself for ticks, the sooner you can remove those ticks, the less likely that you'll be infected with the disease they might carry.
I've interviewed a number of people about Lyme disease just because of the numbers in New Jersey, and everybody says the reason that there's been an increase in Lyme disease is because there's an increase in ticks, and there's new kinds of ticks that are coming into this country. And they say that's because we're not controlling the deer population or the population of some rodents. Would that be effective?
Yeah, well, I think a number of the interventions that we're looking at for Lyme disease are not just based on pesticides and repellents and personal protective measures, but also doing things like excluding deer from areas around your home. Deer removal has been studied, it's been looked at, and also various approaches that look at vaccines that could be delivered to the mice that are the reservoirs for the Lyme disease agent, and also even little boxes so that when the mouse goes into the box to eat some food, it is treated with a chemical that's going to kill the ticks that are on the mouse.
So you're on this.
Yeah, so we look at all of those approaches, and together we call that integrated pest management. IPM is using a number of different approaches to try to most effectively prevent ticks.
We just talked to Congressman Smith, and he has a bill that would increase funding for the CDC, specifically when it comes to Lyme disease. I know you can't talk about the politics of the bill, but if you were to get that extra money, how would you use it?
Yeah, well, there are a number of things that we'd like to be able to do. The first is to increase the funding that we make available to states like New Jersey, and so that the state health departments will have more support to be able to do better prevention, better surveillance, all those types of activities, education and training. So that's one thing. The second thing we'd like to do is to increase support for research. You mentioned diagnostics. We need better diagnostic tests. So that's a huge area. And the third area is really just increasing the tools in the toolbox that we have for preventing tick bite. You know, better interventions, better insecticides, you know, just those types of things.
And some of the stuff you talked about when controlling the deer population, keeping them away from your home, maybe treating some of the mice and rodents so that they don't get ticks in the first place, that would increase too? If you had more funding, that would be more readily available?
Well, what we'd like to do is you know, provide funding to conduct research to develop those tools, to evaluate some of those tools that are already in the pipeline. There are a number of different tools that have been developed: bait boxes, rodent-targeted vaccines, deer interventions, and those need to be better evaluated so that we can make recommendations that are really based on strong data.
It's good that you're on this. It's good that Chris Smith is trying to pass a bill to get you more money. I hope you get it.
Yeah.
Thank you, sir.
Thanks, Larry.
I appreciate you being here. Dr. Ben Beard for the Centers for Disease Control and Prevention. We'll be right back. Still to come on Jersey Matters, we'll show you how one town is dealing with the problem of lead in the drinking water. That's when we come right back.